Hello everybody and welcome to Nclex Prep. Today we're going to be reviewing one of the questions that may look like on the Nclex exam. If you have any questions, please do not hesitate to contact me at nclexprep@outlook.com. Find me on Instagram and like this video if you like, or leave any comments below. Thank you. So let's start with the first question. Please pause your computers or cell phones while you read the question and answers to answer it correctly. So the question is, Jen is a nurse from a medical surgical unit. She was asked to float on an orthopedic in which she has no prior experience on working on. Which client should be assigned to her? So when you're writing Nclex exam questions, first, to go forward with the answers, you must understand what the question is asking. So let's highlight some of the very important points here in this question. So Jenna is a nurse. It does not say if she's an LPN or an RN. She is working on a medical surgical unit, and she was asked to float on the orthopedic unit, which clearly indicates that she has no prior experience. This is very important. Which client should assign to her? So now that we broke this particular question into a few important sections where the nurse has no prior experience and she's going to an orthopedic unit from a medical surgical floor, in these types of questions, an RN is treated such as an LPN. Which means, so that is equals to stable versus unstable patients. Unstable. So now we came to the point across to make our conclusion. So let's take a look at each of the answers. A client with a cast for a fractured femur and who has numbness and discoloration of his toes. So this client has numbness and discoloration, which means this patient may have a neurological deficit. And don't forget, we're in an orthopedic unit, yes, with no prior experience. With number B, a client with balanced skeletal traction and needs assistance with morning care. Now, this seems to be like a more stable patient. However, a morning care is provided by the UCP. We're going to leave all answers right now. C, a client who has above knee amputation yesterday and has currently a temperature of 101.4. So yesterday is not bad, however has a fever which may indicate infection. And this is something serious and important. A client who has a total hip replacement 2 days ago and needs blood glucose monitoring. Okay, so with this particular answer, the patient had a total hip replacement. Now this takes place of 2 days ago. This particular patient is yesterday and needs a blood glucose monitoring, which is important and can be done by the nurse. Don't forget, in these particular types question, an RN is treated as an LPN, which means We're looking for a stable patient. So with number A, we're not going to take this answer just because this may indicate something neurological and she has no prior experience how to handle these situations. We're also going to take C out just because this patient has an infection and needs to be further assessed. B would definitely come out because it is a UCP who could handle this particular patient. So the only answer that we're left with is D. A patient who had a total hip replacement 2 days ago, so less acute, and needs a blood glucose monitoring. So this nurse can definitely do that assessment and see. So here's the answer with the rationale. The client who had total hip replacement 2 days ago and needs blood glucose monitoring. The nurse from the medical surgical floor floated to the orthopedic unit should be given clients with stable condition. Okay, this is very important. We already discussed this. As above, care similar to her training and experience. So her competence, do not forget that. A client who is post-operative state is more likely to be on a stable condition. Okay, thank you very much. Thanks for watching. And again, if you have any questions, please do not hesitate to contact me at nclexprep@outlook.com and find me on Instagram. Thanks and great job.